right, so welcome back inside the Now Morning Show right here on TTT, the home of Carnival. Thank you guys so much for being here with us this morning. I appreciate each and every one of you being here. And this morning we have a fantastic lineup for you guys, as we usually do. We're kicking things off this morning with a conversation with the N.C.R.H.A Regional Health Authority. And we're going to be talking about some recent accomplishments. Well, they were announced recently, but really and truly the entire 2020 saw the entire health ministry and all health services having to step up, and they've done so with such pride and with such vigor, so fantastically that we're very proud to have them on the show this morning. I want to welcome Dr. Malachi Ojuro, the Director of Health Specialist in Emergency Medicine and Health Administrator, Dr. Nadia Hussain, Consultant Obstetrician and Gynecologist, and Heather Wilson Hall, Nursing Administrator at the Education Registered Nurse, Licensed Midwife and Nursing Administration. Good morning and welcome to the Now Morning Show.
Good morning. Good morning. Thanks for having us.
All right. Thank you very much for being here. Dr. Malachi, I want to start with you. I want you to make the big announcement about the congratulations that Mount Hope Hospital deserves for this 2020 session.
Good morning and thanks for having us. An opportunity for us at N.C.R.H.A Regional Health Authority to showcase the hard work of our staff. Is our entire team that did this excellent work, and we are happy to announce for the year 2020 that we had 0 maternal death at the Mount Hope Women Hospital. So it's something that the entire national community should celebrate and be happy about.
I definitely agree with you 100%. And Dr. Nadia Hussain, can you tell me what do you think attributed to this fantastic outcome of 2020?
To reiterate what Dr. Ojuro just said, is basically a lot of teamwork. So we must commend our good leadership. It's good leadership from all different levels of staff, doctors, nurses, different levels. But what is key to this is having everyone work together. So additionally, in addition to that, we have a lot of training sessions at our hospital as well. So even though the pandemic proved to create challenges for us, we still continue to train throughout the year as we do usually.
All right. And Heather Wilson Hall, as a nursing administrator, what is the role that the nurses play in making sure that not just the training is implemented, but how do you guys make sure that you continue motivating the staff to be encouraged to be able to bring out their best foot forward when they come to work every single day?
Well, we support the nurses as far as possible. We have encouraged the nurses to continue in their training, continue to work together with the doctors. We support them in all their endeavors. We have tried to be flexible to ensure that they are able to function optimally. The pandemic did prove challenges because a lot of persons had their children having to go to online school. We tried to be flexible and we ensured that everybody was able to work together as a team.
Nice. I mean, see the teamwork definitely showing. Dr. Hussain, in the past, there would have been situations that would have unfortunately led to maternal deaths and at the Mount Hope or at any hospital. What generally are some of the things that causes maternal deaths, and how did you guys remedy those challenges?
So basically, anywhere in the world, maternal mortality is something that we cannot escape from. So what we usually do, but there are things that we could actually reduce the risk with or prevent, and some things that absolutely we cannot change. So if we have a bad outcome or case like that, usually what we do, and as is now, we have meetings every month and we go through any bad outcomes that we have. For many reasons. One, it could be a teaching or learning lesson. Two, it could be just to commend the team for the good work they have done. And also, the continuous training as well, that would actually help to improve whatever deficiency or problems we may have encountered.
If I may come in here as well, some of the things we did to accomplish this great success has to do with the training and early recognition, try to recognize early some of the complications that could lead to maternal death. For example, chronic non-communicable diseases like diabetes, that if they're uncontrolled in pregnancy, could lead to maternal death. Mm-hmm. So one of the things we did at N.C.R.H.A, which actually happens across the entire public health sector, is that we initiated diabetes screening in pregnancy, whereby pregnant patients are screened, and if diabetic, they're identified very early, and they're also treated very early. to prevent bad outcomes.
Okay, fantastic. And as I have here, Dr. Malachi, I just wanted to find out as well, in terms of leading this team forward, how many, are there more challenges going into 2021 with the pandemic still looming, or is everything kind of balanced out so the dual healthcare system is working, the parallel healthcare system?
So it will not be correct to say that the pandemic is not a challenge. Globally, everybody is facing this pandemic. You may remember that this virus is something that is new, and we are all learning about it as we go along. So the pandemic poses a specific challenge in the entire health sector. However, like I said, our staff have always lived up to the expectation. So what we are asking the public to help us do is to follow the public health guidelines. Mm-hmm. For example, to wear your masks, to do your social distancing, to wash your hands. That will help us in combating the other aspects of the pandemic that will impact on what we do in the public health sector.
All right, fantastic. And besides those fantastic words of encouragement and warning for the public, any plans for 2021 that you want to make us aware of?
So 2021 is shaping up to be a much better year than 2020, given the fact that most likely we will begin to see vaccinations to bring down the impact of this virus. And given that, most of our outreach will now be expanded so that we will also be reaching out more into the community more than we are accustomed doing, given the pandemic outbreak. So we are looking to expand on our success and target other areas like infant mortality and try to bring it down. So we have a lot to offer for 2021.
And we look forward to working with you, and we encourage the public, of course, to work with you guys to make sure that we can get the best possible outcome for all these situations. I want to thank you all for joining us this morning, Dr. Malachi Ojuro, Dr. Nadia Hossain, and Heather Wilson Hall, all of the North Central Regional Health Authority. Thank you guys so much for being with us, and congratulations on Zero Maternal Deaths in 2020. We look forward to Zero Maternal Deaths in 2021, as well as, the infant mortality rate going down as well. All right, so thank you guys very much. I'm going to take a quick break, and when we come back, we still have more. We're talking acting when we come back.